Cheers to a day in the life of a CRNA.
Essentials for my lunch bag. Creamer for my second cup of coffee. My breakfast smoothie. And let's not ever forget our Celsius. Most important.
What's up, guys? Good morning. I'm on my way to work. So I just wanted to give you guys a quick rundown and kind of show y'all what it's like a day in the life as a CRNA. So for those of you that don't know, CRNA stands for Certified Registered Nurse Anesthetist. So before I went to grad school for anesthesia, I was an ICU nurse. Loved it. But I just knew I wanted to practice anesthesia. Actually, it was in nursing school when I decided that. So anyway, so I am officially now an anesthetist. I put you to sleep, keep you nice and comfy, wake you up comfy, and yeah, just overall take care of you during surgery. My scope of practice covers everything anesthesia related. I work at a small community hospital. I love it because I love regional anesthesia. I love everything hands-on. So when I get there, from the start to finish, my patients are mine. I pre-op them, I assess them, I go over their medical history, their previous anesthetics, and I determine what is the best anesthesia plan for them. There are so many different kinds of anesthesia plans that people don't realize. You have general anesthesia, you have spinal anesthesia, epidural anesthesia, you have regional. You also have what we call twilight anesthesia. And a lot of it can be confusing, and I would definitely love to do like a Q&A sometime and just give you guys like a general knowledge what to expect when you or a loved one are going to get anesthesia. But today, I'm on my way. The beautiful thing about my job is I live about a minute away, so I'm already there. Pulling in the driveway, I get here around 6:45, between 6:45 and 7. Go in and get changed, check out my cases, my assignments. I get the assignment the day before, but we kind of just work together, go in, and everyone just kind of works together and picks the case. So we will see what I'm doing today. I'm excited to bring you guys along. Today I checked the board. Looks like they added on a few cases, so it looks like it's gonna be a nice, easy day. Let's see what it's got for me. All right, so I'm here. Gonna get set up here in a minute for my room. We got a pretty busy day, so I'm just gonna grab a jacket real quick. Got my jacket, and I would just like to say I got the world's shortest scrubs today. It's the luck of the draw. I'm gonna go ahead and see my patients now. I'm just waiting now for the surgeon to get here, see the patient, and then we'll be ready to rock. So I have got all my meds ready. I've got my machine all ready to rock. I like to have it all checked. Make sure I have my suction good to go, my ambu bag, my backup tanks, my machine running properly. I'm just doing a MAC today, so I'm just using a nasal cannula and the monitors, but I will have my ventilator ready in case I need to backup use it. So I usually like just have a airway on hand and a LMA just in case. So the thing about anesthesia is to be prepared for what you don't know what's gonna happen, because 9 out of 10 times it goes as you plan, and the other time it just really doesn't. So the key is to be prepared. And yeah, so like I said, I'm doing a beer block today. So beer blocks are not super common anymore, but we do them a ton here for all of our carpal tunnel releases and any hand surgery. So one thing I can't talk about is the beer block that I'm doing today. So this is a type of anesthesia where we put a tourniquet on your lower forearm about here. I wrap your arm, extenuate all the blood out, and then tighten your forearm tourniquet, and then you have an IV in your hand, and I insert a local anesthetic. And because that tourniquet is tight, that local anesthetic stays right up in here, and she's able to do surgery on the hand without having to do a deep general anesthesia, which is super awesome. The less anesthesia we can give you is just better for your body overall. So everyone does it a little different. I'm doing a lower forearm tourniquet, so I'm going to use a 2% lidocaine, which is a higher concentration than other beer blocks, but because I'm doing it in the lower forearm, I don't have to use as much, and I can use a higher concentration. And then I'm also doing Toradol in there as well. So yeah, so that's for my
Going for round 2.
Okay, I am on my way up to the floor. I have an inpatient case, so whenever we have patients that are in the hospital, I go to the floor, see them in the room. So I'm gonna go up there, pre-op my patient. We are about 3 cases in. I have about 3 more to go. 2 cup of coffees in, on a smoothie. Okay, my day is officially over. Well, for now. My shift for the day. So every day, I love this job so much because every day it varies. So I'm at a smaller community hospital, so we don't do a ton of trauma. Got in there a little before 7, worked until, and I got off around 1. So I'm gonna go home, hang out with my kiddo, get some stuff done around the house, go work out, and then I'm on call starting at 6 tonight. I love being on call, which is like so opposite than a lot of CRNAs. A lot of CRNAs hate being on call, but it's a great way for me to still get my hours in, work full time. You get to see some like unique stuff on. So I'll get called into the ER to do central lines, to do epidurals, C-sections. So you just get to do a lot of more interesting stuff being on call. I do kind of love being on call at a smaller hospital because you don't get called in as much, I will say. So it's just pulling in. So yeah, so I'll be on call starting at 6 and then all through the night. And then I'm on the call shift tomorrow. So that just means I will be on call again until tomorrow night. So yeah, so I'm gonna go home, enjoy some time with my fam. See you later. So I'm just leaving the hospital. I was on call last night, got called in around 4 for a emergent C-section. Jumped out of bed, throw on a pair of pants, run to the hospital. Thankfully I live like 2 minutes away, so I was able to get there in about 4 minutes after I got called. Ran in, threw on some scrubs, ran to the OR. The patient was already on the table. They were hooking her up to the monitors, so I real quick pulled up a couple drugs, got my airway, turned on my ventilator. So usually when I go into the OR, I set up all my drugs nicely, go through my whole ventilator, do a vent check. Thankfully, the emergent room, they have all ready to rock and ready to go. So I go in, and about 2 minutes after that, I get the patient off to sleep. I think it took about 2 minutes after that for the docs to get scrubbed, come in, and cut and get the baby out. So all in all, it took about 8 minutes total for getting in the room, getting the patient hooked up, getting him to sleep and getting that baby out. Thankfully, mom and baby are both doing really good. The mom was laboring, and the fetal heart rate just started dropping, and the baby was in distress. The baby was positioned in a way that the doctor could not assist the mom in delivery, so they had to do an emergency C-section. Thankfully, medicine is just incredible what we can do now, especially with C-sections, and the outcome is often we can help both mom and baby do well and recover well, which is a miracle to me. So it's awesome to be a part of that. I love it, even though it's 4 a.m., get up in the middle of the night. It's just, it's such a rewarding job, and keeps you on your toes. So yeah, welcome to a day in the life of a CRNA and just what that looks like. And I'm just excited for you guys to come along and see a piece of it.
Got called in last night for the emergency section, so thankfully I was able to come home, get like an hour and a half hour of sleep, and now I'm going to get ready and go back in for my day of work. Alright, I'm get dressed and ready to go. Alright, days like today, when I was up at 4 a.m. going back into work, usually end up being sweats, teas, and tennies kind of day. So at least I got some coffee. Cheers. All right, guys, just got back to the hospital after my night of call. So I came in last night for an emergency section. Here's a little bit of a difference between a small town and a big town hospital. You have to be very proficient what you do. You have to really be able to practice independently and do well with just what you have. So when I got here, it was the surgeon, well, the OB doc, the ER doc, and a paramedic. Usually you go into OR for a C-section and there's a scrub tech, a circulator, multiple people helping. You have the neonatal nurses, you have the patient nurses, the anesthesia. So I walk in and it's like they're hooking the patient up to the monitor, they're getting ready to go. So I had about 2 minutes. I drew up a couple drugs, I got an airway, I got a blood pressure really quick, and as I was doing that, the surgeons went out and started scrubbing. No scrub tech, no circulator. Got that baby out. Thankfully, both mom and baby are really healthy, doing really good. Yeah, so then at that point, it's just kind of, because it's such a fast process, the doc works to get the hemorrhaging under control. I work to stabilize the patient, and now I've got to think about recovery. Okay, what can I do to help this mom recover with such a traumatic experience? They have to worry about nausea and vomiting. You're gonna have severe, just a lot of pain. C-sections are not a dainty little surgery. So I think about pain, I think about recovery, all that stuff. And then also, I just hope she responds well to anesthesia, because I have no health history as far as that goes. So I decided to do what we call a tap block, a bilateral tap block. So you have a big incision in your lower abdomen. And so I did a regional anesthetic technique. While she was still asleep, I used an ultrasound and there's a sheath of nerves that travel down either side of your abdomen, underneath your internal and external obliques. So I find an ultrasound, I go down and find that sheath of nerves, and I just soak it really good with a local anesthetic. And the goal for that is when they wake up, their pain isn't so severe because of the incision. Now, that pain is gonna eventually come, but the beauty of a block is it helps with when they wake up, they can slowly, everything varies, maybe like 12 to 14 hours, that pain slowly comes back, and we can help them manage it. So I'm gonna go in now, get ready for the day. Thankfully, my partner covered my first case for me, so I got to go home and get like an hour and a half of sleep and make some coffee and just get cleaned up for the day. So yeah, until next time, welcome to a day in the life with CRNA. All right, so I am in the colonoscopy EGD room today. We're doing a bunch of different scopes and EGDs. Colonoscopy is where they go up the rectum area, look for, it can be a screening, it could be to biopsy, to diagnose something, look for bleeding, stuff like that. And then also EGDs, you go down the esophagus, and same thing, it could be screening, it could be you have something going on that they have to check out. So
What I do is I come in here, I've already done my machine check. I go and make sure just my suction's hooked up. For these, we just hook up the monitors, put a little oxygen in. I pull up some basic drugs, and it's a pretty light anesthetic, what I call just your twilight anesthesia. And I like being in here because I don't have to wear my silly hat, and it's pretty chill. So I like to come in here. I've already interviewed my patient, went over everything, explained everything, went over his allergies and all that fun stuff. So for colonoscopies, really just have to keep them nice and comfy. So I just use propofol and lidocaine. If I do an EGD, I'll use sometimes these little fentanyl to blunt the gag reflex, which obviously you think about that, something going on your throat. It's a big scope, it can cause you to gag. But today, just using some propofol and then just some lidocaine. Propofol is a wonderful drug. Keeps you nice and comfy. It actually helps with some feeling nauseous afterwards. It has anti-emetic effects. But sometimes it can really burn when they push it through your IV. So I try to give some lidocaine right when the patient comes in and let that kind of sit in the IV for a minute or two before we get you off to sleep. And honestly, for whatever reason, sometimes it doesn't affect everybody, but it's just a habit I've gotten into. So I pull up my drugs and I get my monitors ready, and that's about it. Being in this room is not bad at all. And I really enjoy the people I work with. Everyone's super kind, and we just have a good day of work. I think it's super important to enjoy what you do, enjoy your environment, and I know that's not the case with all my colleagues in other places. So I'm just super thankful that I have that, and I really enjoy coming to work. I never wake up thinking, geez, I have to go to work today. It's just, I really like it. So this is what my drug looks like. I hook this part up to the patient. I've got my lidocaine in my propofol, and some people hook up their propofol just to a pump to titrate it. I like to just do it by feel. I have got to a place where I just watch the patient's respirations and their heart rate and their blood pressure and everything, and I will give them doses based on how they're doing. So every day is a little different, but for the most part, I come in, I get changed in my scrubs, I check the board, make sure nothing's changed. If you are the call person, they'll call us and tell us that there's been a change made. Otherwise, look at the board, go to the pre-op area, grab a chart, read through the health history, make sure that they've been approved by anesthesia for surgery. I'll go see the patient, go over their health history, go over the previous anesthetics, any issues. I talk about their allergies, and if they've never had anesthesia before, just what to expect. I am a huge proponent of everything regional anesthesia. So if you or a loved one are ever in a position you're like, I've got to get this surgery done, I know regional's an option, but the person giving me my anesthesia doesn't really want to do it, that is always, just know that you should always have the right to, what's the most appropriate for that case. I'll have people come in and I'll say, I highly recommend a spinal for this, and they say, absolutely not. I have zero tolerance for needles. Do not poke me with a needle. I absolutely refuse. And at the end of the day, it's their anesthetic, it's their choice, it's their body. We do what the patient wants. We can recommend, we can talk about the benefits and the risks and everything involved. But at the end of the day, I want to be an advocate for my patient. So after we go over all that, we sign a consent, and then I get my room ready. Some CRNAs are big into having all of your emergent drugs pulled up. I don't do that. I know where my emergency drugs are in the drawer, and I'll have a couple extra syringes ready in case I need those. But a lot of times, a lot of drugs can be wasted, in my opinion, if you do that. So yeah, and then I get ready for my patient, and then after the surgeon's seen him and the nurses have seen him, they bring him back and we get going. Every day it's fun. Every patient's different based on their history, and I just the whole continuity of care for me. You have to really think through each specific patient, and yeah, so I love that about my job. It keeps me sharp. I have to have critical thinking, and there's no cookie cutter in anesthesia. You have to, every case is patient specific, and yeah, that's why I just feel like every day I come in and it's different, even though it's very similar. So I was once told 95% of the time giving anesthesia is like the most laid back, chill job ever. But that 5% where you push a medication and your patient's heart stops, or you go to put an airway in and your patient starts, vocal cord starts spasming and you can't get them to breathe, and they turn purple and their SATs drop to 0, you know, or close to 0. Those are that 5% that makes up for the 95% where life's good and easy and we're good at this. So it is a high risk career. It is stressful at times, but thankfully we've all been trying to respond with level heads and respond well, make good decisions in split seconds of time. So a few reasons why I love my job, and so currently just waiting for my next case to come up and then I'll be done for the day. So until then, thanks for hanging out with me, guys.
All right, officially done with my first 24 hours. 24 more to go. Got my Celsius to bring me some life because I'm tired, but that's okay. No worries. Got up, did my case this morning, been working all day. Now I'm gonna go home, gonna run to the gym, gonna pump it, and then go home, work on the projects. It's beautiful out, gonna enjoy this day, and hopefully don't get called in, but we'll see. You never know. Good morning and welcome to a day in the life of a CRNA. Heading to work. And I was the call person last night, did not get called in last night, thankfully, so I will take it. And oh man, I try to, when I'm the call person for the day, get there first and get there before everyone else, so I leave a little earlier than other days. And yeah, so just on my way now and excited to bring you guys with me for a day in the life with the CRNA, baby. Okay, so almost done with the end of my 48-hour call shift. So today was pretty busy. Came in, I think I did a total of 6 cases today myself, which is pretty busy for a small hospital like this. We had one of our orthopedic surgeons was doing a bunch of carpal tunnel and different type of tendon releases, and then she had an ORIF of the a radial bone was just shattered in multiple places. So for that was my last one I did. So there are, like I said before, there's lots of different ways to do anesthesia and to keep a patient sedated and keep them comfortable. We are big proponents of regional anesthesia as much as we can. So I did a supraclavicular regional anesthetic before the surgery, and then I bring him back into the OR, just put a little propofol drip up, and the patient stays breathing on their own, and he did super good, super comfortable. I did give him a little bit of fentanyl Versed before the block just to get him comfortable. Overall, I really love my job, and I just want to encourage anybody out there that is even considering looking into anesthesia and becoming a certified registered nurse anesthetist. Go for it. You will not be sorry. School's long, it's hard, it's a huge commitment, but at the end of the day, you know, it's important to do what you love and to go into work every day and just love it. And I can honestly say so far, I've just loved it. I also think it's important to really figure out what you want in a job. For me, I wanted a job where I could do regional anesthesia. I wanted a job where I could be autonomous and be in charge of my patients from start to finish. And so that meant I had to look for a smaller hospital. I'm not in as big of a hospital, which is fine because I still get a ton of experience. I get to do a ton of regional, spinals, epidurals, big general cases. So I feel like I'm really able to grow in areas that I wouldn't otherwise be able to grow at in a really big hospital, you know.
it was important to me as being a mom that my hours weren't such to where I was gone all the time. You know, I live 1 minute from home. There are days that I get off at like noon or even 11 sometimes, and I'm just close in case they need me. So at the end of the day, it's such an awesome career. You can kind of tailor it to what you need and what you want. Now I'm gonna finish up the charts and make sure everything else is good, make sure OB is good, the hospital's quiet, and then I get to go home. Today's my Friday, so until next time, have yourself just a great week. Just remember, no matter how long your day is, it's always better with the selfie desk.